floor to the Secretariat to introduce the item and for the updates from the Independent Panel for Pandemic Preparedness and Response, the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, the Review Committee on the Functioning of the International Health Regulations 2005, and the Global Preparedness Monitoring Board. Secretariat, you can have the floor now.
Thank you, Your Excellency. In my report to the Executive Board yesterday, I said that we all have lessons to learn from the pandemic, every member state and the Secretariat. I said that we're committed to accountability and that we will continue to learn, to change, and to listen. And I described some of the lessons the pandemic has already taught us. Several review processes are underway, examining different aspects of the response, and today you will be hearing from the chairs of the Independent Panel for Pandemic Preparedness and Response, the IHR Review Committee, the Independent Oversight and Advisory Committee, and the Global Preparedness Monitoring Board. As you know, in accordance with World Health Assembly Resolution 73.1, I established the Independent Panel for Pandemic Preparedness and Response to review experience gained and lessons learned from the pandemic and to make recommendations to improve national and global preparedness and response. WHO is grateful for the panel's work to date, and we look forward to its final report and recommendations. Today, I'm pleased to welcome the panel co-chairs, the Right Honourable Helen Clark, former Prime Minister of New Zealand, and Her Excellency Ellen Johnson Sirleaf, former President of Liberia, and to brief you on the panel's interim report. Former Prime Minister Clark, former President Sirleaf, thank you for your commitment and for joining us today. You have the floor. President Sirleaf or Prime Minister, yeah.
Yeah, Helen is on, but she's mute.
Can you unmute, please? I think it's from our side, probably.
Yeah, they control the. Madame is unmuted. But Madame doesn't go first.
I just put my up just in case.
Have you? Huh? Who speaks first? President Sir, okay. So Prime Minister Clark is speaking first. So can you unmute if it's...
Thank you. Thank you, Dr. Tedros. Minister Varden, Chair of the Executive Board, all members of the board and guests of the Executive Board, thank you for enabling Co-Chair President Sirleaf and me to brief you today on some of the emerging findings and messages from the independent panel's second progress report. Obviously, all of us gathered here are so acutely aware that the pandemic we are experiencing is unprecedented in our lifetimes, and that it continues to rage, and that COVID-19 itself continues to evolve. 2 million people have died. There have been over 95 million recorded infections. These are sad milestones. The impact on human lives, the great strain placed on health systems, and the scale of the social and economic devastation brought about by the pandemic make it clear to our panel that the world needs to do two things: act more decisively now to stem the pandemic, and fundamentally to reset preparedness and response systems to help ensure that this can't happen again. And those 2 points are at the core of the panel's progress report, which we're presenting to you today. These are, of course, not abstract policy issues. In a recent meeting, which our panel hosted with the global nursing community, we heard directly from nurses about the crisis they see in healthcare facilities. So many nurses, they report, are burnt out. They report that many colleagues want to leave the profession when the main impact of the pandemic is over. Yet already the world was estimated to require the creation of 6 million more nursing jobs by 2030, and Exodus now exacerbated those pressures. And that's just one of so many spillover impacts of the pandemic. Since we were appointed by the Director General as co-chairs of the panel in July last year, we've heard from a wide range of stakeholders, and the feedback we've received has included very helpful and forward-looking contributions made directly by member states. We have made progress on synthesizing all the contributions received, and we are building the necessary evidence base required for the comprehensive, impartial and independent review of the international health response to COVID-19 with which we were tasked. While our evidence gathering continues, the progress report before you now does have an unequivocal message that course correction and handling the pandemic is needed now. And our panel does strongly recommend that all countries immediately and consistently adopt and implement those public health measures which will reduce the spread and the impact of COVID-19. Simply put, we must do all we can to stop the pandemic now, and there are the means available to do so. The tools which can reduce the numbers of cases and deaths must be used. Those tools are familiar to this audience: the need to test and detect cases as early as possible, to do the contact tracing, to do the isolation of those infected, to reduce the spread through physical distancing and mask wearing. These measures are as relevant now as they were at the outset of the outbreak. The countries which make consistent and sustained efforts to implement such basic measures will benefit from reduced transmission, illness and deaths. Our panel's report does identify a series of critical early failings in the global and national responses to COVID-19. There had been a failure to prepare adequately for a pandemic threat, despite years of warnings that better preparation was necessary. Taken as a whole, the preparedness metrics which were being used did not appear to predict how well individual countries would be able to control COVID-19. Perhaps because they couldn't capture what seems to be a critical dimension in pandemic control. That is the mix of government effectiveness, concerted leadership, capacity to work with communities, and being able to be guided by science. The report does consider whether the international system acted fast enough to detect and alert the world to this novel infectious pathogen with pandemic potential. And once the alert was issued in the form of the public health emergency of international concern, whether countries were fast enough to respond. Let us be clear, there can be no doubt that many people were working very hard at the time the new virus was emerging in order to understand what was happening and to mitigate the threat. What we say here today and in our report is in no way a reflection on the commitment of dedicated professionals it's all oriented towards learning for the future. With the benefit of hindsight, detection and alert may have been speedy by the standards of earlier novel pathogens, but viruses move in minutes and hours rather than in days and weeks, especially in the highly mobile and interconnected world of today. Then, when almost 4 weeks after the new virus was identified, the WHO declared the highest possible alert agreed in the international system, that public health emergency of international concern, too many countries failed to act quickly and decisively enough to apply necessary and recommended public health measures. The panel believes that the international system for alert and response has the trappings of an analog system in a digital age. Modern information systems pick up signals of potential disease by sifting through hundreds of thousands of data points daily, outpacing formal country reporting and outpacing the procedures and protocols of the international health regulations, including that all-important declaration of the public health emergency of international concern. So the panel is looking at what might be needed for mechanisms to work at the speed necessary and to be able to integrate signals into real-time, globally available data gathering and decision-making tools. Let me now hand over to Co-Chair President Sirleaf to share some more of the messaging and finding from this interim report. Thank you.
Thank you, Prime Minister Clark. Greetings to all of you. I want to underline 2 additional concerns from the panel's report. First, the pandemic has laid bare inequalities both within and between nations, and the response has deepened those inequalities. As with so many pandemics in history, poorer nations have missed out when it comes to the means to fight the pandemic. And in wealthier nations, it has been the least well-off who have suffered most. The panel believes that the systemic and structural inequalities which have been made worse by the pandemic must be the lens through which we view all of our work. This is true whether we look at the unequal impact of the virus on marginalized communities, such as migrant workers and indigenous communities, or at the unequal access to testing, supplies, medicines, and vaccines. We are grateful to scientists for developing vaccines in record time. As 2020 ended, we felt hope. But the panel is discouraged and frankly disappointed by the unequal plans for vaccine rollout. Tens of millions of doses of vaccines are already available in some of the wealthiest countries. But based on current plans, vaccines will not be widely available across the African continent, for example, until 2022 or even 2023. As our report says, where you are born should not be the factor that determines your place in the vaccine queue. As former leaders of our countries, Prime Minister Clark and I understand the massive political pressure every leader is facing to vaccine all of their own people first. But it is unacceptable for wealthy countries to be able to vaccine 100% of their population, while poorer countries make do with only 20%. It is no exaggeration to say that we are at risk of creating a vaccine distribution system grounded in inequity. We cannot let this happen. The panel believes that fairness based on public health needs, not narrow national interests, should determine who gets access to the vaccine and when. Speeding up vaccination for all and investing in the frontline health workers and primary healthcare systems that deliver them isn't just the right thing to do. It is the smart thing to do. No one is safe until everyone is safe. Second, let me now underscore another key finding in the panel's report. The panel believes, like many of you, that major changes in the system which should protect global health are needed. After every new pandemic or other major health threat, there are many evaluations which come up with dozens of recommendations. They are nearly too numerous to count, and too few of them have been acted on. The panel expresses deep concern at the level of action which has followed earlier reports, and we hope member states share that concern. This mistake cannot be made again. In November, member states challenged us to make recommendations which were implementable, costed, and had clear timelines. We were challenged to be unafraid to speak uncomfortable truths. From our interviews and meetings with member states, we know that there is recognition of the need for action. This is a unique opportunity born out of the gravity of this crisis to reset the system. Real change in global and national health systems that will benefit every country and every citizen must challenge the status quo. That means we need to listen more to healthcare workers and heed their advice. It means drawing on the knowledge of those who manage local responses, such as mayors, and it means not only hearing, but also acting on what people on the margin of society are telling us. Their experience of what goes wrong will show us what we must do to make it right. Our report makes it clear that the world is more reliant on an effective WHO than ever before. But while member states turn to the WHO for leadership, they have kept it underpowered and under-resourced to do the job expected of it. For example, many of you have pointed out that if WHO is expected to raise perpetually because assessed contributions to it remain low, then this will come at the expense of its ability to focus on pandemic preparedness and response, among other core priorities. Pandemic preparedness financing has been treated as a cost to come out of a limited official development assistance bucket rather than what it truly is, a global public good, an investment in our collective future. This unprecedented pandemic has led to unprecedented challenges for our world. If we do not act now, then when? If it is not us, then who? I will now hand back to my co-chair, Prime Minister Clark.
The report will obviously go into more detail and make a series of concrete and evidence-based recommendations on creating a fit-for-purpose pandemic preparedness and response system. The panel is very grateful to the many stakeholders who continue to provide us with information and ideas, including through the panel's website and including member states. In the interests of transparency, we will continue to post our meeting reports and key materials which we are considering on our website, including written contributions made to the panel. We will also continue to host public exchanges like the one with the global nursing community to which I referred earlier. There's still much to learn and to analyse. We do look forward to the ongoing feedback, comments and suggestions of member states. What we've presented to you is just an interim report on the progress we're making. This is not our main report. The international community is at a crossroads with respect to pandemic threats and responses. The choices which are made in the coming months will show whether our world is determined to be more prepared, more health secure, more equitable and more resilient. Let me now hand back to you, Chair of the Executive Board, and we look forward to hearing from the chairs of the IHR Review Committee, the IOAC and the GPMB, and to hearing the feedback of the Executive Board. Thank you very much.
Yeah, thank you. Thank you so much, President Sirleaf and Prime Minister Clark. The international health regulations are an essential legal instrument and the foundation of global health security. Even before the pandemic, I had spoken about how emergencies such as the Ebola outbreak in Eastern DRC demonstrated that some elements of the IHR may need review, including the binary nature of the mechanism for declaring a public health emergency of international concern. In August, and in accordance with Resolution 73.1 and the provisions of the IHR, I convened a review committee to examine the functioning of the IHR during the pandemic. This is the first time a review committee has been convened under the IHR. I'm very grateful to the committee for its work over the past few months, and I would like to welcome its chair, Professor Lothar Wieler, to brief the board on its work so far. Professor Wieler, thank you for joining us today, and you have the floor.
Excellencies, Director General, ladies and gentlemen, thank you once again for the opportunity to provide you with an update on the work of the Review Committee on the functioning of the international health regulations during COVID-19. As you know, this committee was convened by the Director General on 8 September 2020 in line with World Health Assembly Resolution WHA 73.1. The committee is composed of experts with a wide range of expertise and with adequate gender and geographical representation. I have the honor to be the chair of this committee and am ably supported by our vice chair, Professor Lucille Bloomberg of South Africa, and our rapporteur, Professor Preben Arvidsland from Norway. Our mandate is to review the functioning of the international health regulations during the COVID-19 response and the status of implementation of the relevant recommendations of previous IHR review committees, and to make technical recommendations to the director, including any potential amendments. We convened for 16 closed meetings so far, and we continue to work through 3 subgroups: preparedness, alert, and response. I take this opportunity to reiterate my thanks to our 3 subgroup leads. We also convened 5 open meetings when we provided updates on our work and listened to the submissions and questions raised by member states, international agencies, and non-governmental organizations in official relation to WHO. These open meetings continue to be attended by numerous designated representatives. I reported on our progress to the 73rd World Health Assembly on 9 November 2020, and I continue to interact regularly with the co-chairs of the Independent Panel for Pandemic Preparedness and Response and the chair of the Independent Oversight Advisory Committee. Let me now turn to the substance of our work. I invite you to read our interim progress report, document EB 14819. It details our preliminary findings as of December 2020, which were reached following numerous interviews, discussions, and the review of a wealth of documentation. Let me point out the most important ones. A. Member states and experts overwhelmingly support the IHR as a cornerstone of international public health and health security law, but several areas need improving if we are to be better prepared for the next pandemic. While we have not finalized our article-by-article assessment, there is a growing belief in the committee that most of the necessary improvements can be achieved through more effective implementation of the existing provisions of the IHR and do not require at this point changes to the design of the IHR. B. National IHR focal points need to be further empowered, including where necessary through national legislation. National focal points play a critical role in the timely sharing of information, but their limited authority and status often lead to delays in notification. The committee noted that effective IHR implementation requires many functions that are not within the narrow mandate of the national IHR focal points, such as multi-sectoral coordination for preparedness and response and collaborative risk assessment. The absence of a dedicated national entity with sufficient authority and a clear mandate to take ownership and leadership is considered a significant limitation to effective implementation of the IHR at national and subnational levels. At country level, national IHR focal points need to be integrated in the National Emergency Plan as well as the National Health Committee or similar body. C. The possible need for an intermediate level of alert before a public health emergency of international concern is declared, the FEIC, is also under consideration. The previous review committee on the Ebola response recommended such an intermediate level, but this recommendation was not taken up. The 5th open meeting of the committee on 12 January 2021 discussed issues surrounding the possible introduction of a grading system. The different views expressed by member states and the advantages and potential disadvantages of a new system will be further studied by the committee. It is clear that global preparedness, alert and response actions need to start much earlier and more decisively than they did during COVID-19. But it is far from certain that introduction of an intermediate level of alert would result in such earlier action. The committee is considering how regular global and regional risk assessment can be used better to drive earlier and more targeted response measures at all levels. The aim, the committee feels, should be to react early and strongly enough so as to prevent the need to declare a FIG. D. Compliance with AHR provisions remains a challenge in several areas, from setting up core capacities to implementing travel measures during health emergencies. The committee is mindful of the lack of teeth in the IHR. We are therefore looking at new ways to monitoring and evaluating adherence to IHR, both in preparedness and response, and to strengthen existing tools without overburdening countries. Considering a peer review mechanism similar to the universal periodic review used by the Human Rights Council may be useful in improving preparedness and response. For example, the universal periodic review has been shown to foster intersectoral coordination and whole-of-government approaches, to encourage good practices, and to link implementation of its recommendations with other government aid agendas, all of which are vital to strengthening IHR implementation. It is in this context that the Director General has proposed the Universal Health and Preparedness Review initiative, which is currently being pilot tested. E. Last but far from least, political support and resources for IHR implementation remain insufficient and irregular at all levels. In this context, the committee is awaiting further detailed information on the funding mechanisms for IHR implementation. I would like to clearly state my conviction that we need more meaningful cooperation during and in between health emergencies, more transparency, more regular detailed exchange of real-time data and experiences at all levels, more reliability of interaction and greater speed in sharing data and samples. Fortunately, digital technology supporting such developments is increasingly becoming available, from data mining to find disease outbreaks early, to next-generation sequencing, to follow pathogen around the globe, to virtual conferencing that makes human interaction easier. To come to the conclusion, the deadline for our final report is the 74th World Health Assembly in May 2021. However, as we all know, the COVID-19 pandemic will be far from over in 4 months' time, and therefore our findings and recommendations will not necessarily be complete. Further deliberations may be needed later. Let me reiterate what I said in November 2020 on the occasion of the 73rd Health Assembly. The IHR are your instrument, our instrument of international public health law. Making them work requires giving WHO the tools and the resources it needs to better prepare and protect humanity against public health risks through an effective, coordinated, multi-sectoral and evidence-based public health response. Thank you again for the opportunity to speak to you today, and let me also thank the Director General for the excellent support provided by the WHO Secretariat to this review committee.
Thank you. Thank you so much, Professor Wheeler. When the WHO Health Emergencies Program was created following the West African Ebola outbreak of 2014 and 2015, Member States rightly saw that accountability would be essential for the success of the program. The Independent Oversight and Accountability Committee was established to provide oversight and monitoring of the development and performance of the program and to guide the program's activities. The IOSE has been playing this role successfully for several years before the pandemic and during it, and has contributed to strengthening the current emergencies program. We're very grateful to the committee for its work, and I welcome its chair, Dr. Felicity Harvey, to update the board on the IOS's work and findings so far. Dr. Harvey, thank you for joining us today, and you have the floor.
Honourable Chair, Director General, Your Excellencies and distinguished delegates. Thank you. On completion of its second term of office, the Independent Oversight and Advisory Committee for the WHO Health Emergencies Programme, the IOC, submitted a 4-year review, document A7310, to the resumed 73rd World Health Assembly in November 2020. Under the revised terms of reference for its third term of office, from May 2020 to May 2022, IOC reports annually to the World Health Assembly. However, given the ongoing COVID-19 pandemic, the committee decided that it would be helpful to provide a verbal report to this, the 148th session of the Executive Board. As the DG said, IOC is mandated to oversee WHO's work in emergencies, and the committee has therefore been tracking progress made in implementation of our recommendations contained in both the report, the interim report for COVID-19 from January to April 2020, and the 4-year review report. We will continue to monitor WHO's performance in emergencies and will provide a comprehensive annual report to the 74th World Health Assembly in May. However, today we wish to flag up some issues and concerns. The committee recognises the tireless efforts that Member States and the Secretariat have made in response to COVID-19 and calls on all parties to work together to ensure that all countries have equitable access to therapeutics and vaccines. IOC is pleased to note the progress made since its interim report, and particularly the speed and quality assurance of the WHO's technical guidance. The committee reiterates that member states supported by WHO need to fully implement all public health measures, and surveillance, testing and research efforts should be strengthened to rapidly assess the impact of the new SARS-CoV-2 variants. From the outset of the WHO Health Emergencies Programme, IOC has advised the Director General to safeguard the programme's managerial authority and autonomy against politicisation. The last IOC report, published in November 2020, reiterated that the WHO programme should operate on a principle of a single structure, single budget, single staff work programme, common results framework, with clear reporting lines across WHO headquarters and all regional offices. IOC urges the Global Policy Group to further clarify accountability for health emergency management and recruitment of senior emergency personnel between the regional directors and the executive director of the WHO programme, and to institutionalise the managerial authorities and processes already agreed. In the context of transformation, IOC recommended that there should be dedicated teams for emergencies within the centralised functional divisions, such as human resources, communication, resource mobilisation, procurement and security, with a dual reporting line to the WHO programme, and that key performance indicators should be established to track their impact on WHO emergency operations. The committee is pleased to see there is headquarters management consensus on this recommendation, and its implementation is underway. IOC has repeatedly expressed its concern regarding the lack of predictable and flexible funding of the WHO programme, competing priorities, heavy dependence on a limited number of donors, and the current mechanism for the contingency fund for emergencies. The committee welcomes member states' commitment to and ongoing discussions on the adequacy and suitability of WHO financing. But we reiterate our recommendation to allocate an increased proportion of WHO core flexible funding to the WHO programme, and we express our particular concern at the low level of preparedness funding. While acknowledging WHO's efforts in making security a corporate function and in developing the security strategic plan, The committee is deeply concerned at the lack of clarity in accountability and reporting lines for WHO security functions between field, country, regional office and headquarters. As WHO's role in major emergencies grows and its operations expand in conflict settings, it is of paramount importance to institutionalize a functional security apparatus with a clear accountability framework across the entire organization. Following the allegations linked to the Ebola response in the Democratic Republic of the Congo, Dr. Tedros established an independent commission to conduct a fact-finding process to investigate specific allegations and recommend measures to prevent sexual exploitation and abuse. While waiting for the findings of the independent commission, high priority should be given to identifying areas of high risk for potential exploitation and abuse where WHO is currently operating, and to immediately implement preventive measures, drawing upon the guidance provided by the Interagency Standing Committee on Prevention of Sexual Exploitation and Abuse and lessons learnt by UN agencies and other humanitarian partners. IOC recommends that WHO adopt a people-centred approach in preventing and addressing such incidents in the future by strengthening existing whistleblower and redress mechanisms, building community trust, and putting in place the right local partnerships in high-risk settings to ensure that the conditions for sexual exploitation and abuse do not persist. Overall, the committee is reassured by the action taken so far by the Secretariat and will closely monitor and measure progress made in putting the recommendations issued in our previous reports into practice. We reaffirm our commitment to providing oversight of WHO's work in emergencies and will report to Member States. IOC also welcomes the reports of the Independent Panel for Pandemic Preparedness and Response and of the Review Committee on the Functioning of the International Health Regulations during the COVID-19 response, as well as the Global Preparedness and Monitoring Board statement. IOC is committed to supporting their ongoing work. I thank you.
Thank you. Thank you so much, Dr. Harvey. In my remarks yesterday, I said that we have long known the next pandemic was a question of when, not if. In 2018, in response to recommendations by the UN Secretary General's Global Health Crisis Task Force, and as part of WHO's transformation, WHO and the World Bank joined forces to establish the Global Preparedness Monitoring Board to provide independent and comprehensive appraisal of global preparedness and response capacities. In September 2019, just 3 months before the first case of COVID-19 were reported, the GPMB published its first report called A World at Risk. Last year, the board published its second report called A World in Disorder. I'm very grateful for the board's work, and I'm pleased to welcome its co-chairs, Dr. Gro Harlem Brundtland, former Prime Minister of Norway and former WHO Director General, and Mr. Elhaj Assi, former Secretary General of the International Federation of the Red Cross and Red Crescent Societies. Dr. Brundtland and Mr. Assi, thank you so much for your work, and you have the floor.
Thank you for inviting us to speak here today. The Global Preparedness Monitoring Board, an independent monitoring body, was established in 2018 by the WHO Director General and the President of the World Bank in response to a recommendation from the UN Secretary General's Global Health Crisis Task Force. We comprise political leaders, heads of agencies, and international experts. We advocate at the highest political levels and across sectors for greater investment and engagement in health crisis preparedness. Our first report, A World at Risk, was published in September 2019. The report warned about the risk of a pandemic of a respiratory pathogen that could kill millions, wiping out 5% of the world's economy and creating widespread havoc. We found the world was unprepared. We warned of the inadequacy of systems and financing needed to detect and respond to health emergencies. We urged political leaders to implement the international health regulations, to improve multi-sector coordination, and to invest in vaccine and therapy development. In COVID-19, our worst fears were realized. The world was indeed unprepared and the impact enormous. In our September 20 report, A World in Disorder, we describe how the pandemic has exploited a world in disarray with catastrophic health, economic, and social consequences. COVID-19 has again illustrated that pandemic preparedness must reach far beyond the health to ensure all impacted sectors stand ready, indeed, the economy at large. We have learned that global preparedness is greater than the sum of national preparedness. In an increasingly interdependent world, it is in every nation's interest to cooperate. Nations must invest in common goods and ensure mutual accountability. We have learned that our financial institutions, including the World Bank and the International Monetary Fund, do not have mechanisms to fund global public goods for R&D, including for WHO, and for vaccines for unknown pathogens. This needs to be addressed in a new framework for global health security. A key lesson for all of us is already clear, and it applies to all levels of political leadership in countries large and small. Our multilateral institutions now need to be considerably strengthened, and WHO is a critical part of this challenge. We should all be aware that a review does not necessarily lead to improvement. It may in fact lead to the opposite, especially when urgent actions are required. For example, the last review of the international health regulations, a process we initiated during my time as Director General of WHO, may actually have weakened the authority of the Director General. Pandemic preparedness can yield immense returns on investment, but our current development assistance funding models are woefully inadequate, both in scale, predictability, and in form. We require new approaches, so the world without untoward delay can mobilize financing, common goods, preparedness, and immediate response. I now give the floor to my co-chair, SC, to present the urgent actions that we call on member states and the executive board to take.
Thank you very much, Gro. Mr. Chairman, Dr. Tedros, Excellencies, colleagues and friends. Currently, our most urgent focus is on ending the COVID-19 pandemic. But it is essential to prepare for tomorrow as we respond today. We have learned lessons from COVID-19 at devastating human cost. We must now implement the fundamental changes to preparedness, or another catastrophic pandemic is sure to follow. Member states must ensure that the necessary actions are taken. To end the COVID-19 pandemic, countries must commit to equitable access for vaccines. This is both a moral and a public health imperative. Our pride in the groundbreaking speed of COVID-19 vaccine development is only justified if all countries benefit equally and at the same time. We urge member states to ensure that vaccines and other countermeasures are allocated according to need and impact in stopping this pandemic. Access must be fair and equitable, not based on ability to pay. We call on member states to support the COVAX initiative so that it can provide this access. At the same time, countries must face the future. Bold reforms of global health emergency preparedness and response must be implemented without delay. WHO and the multilateral system must be strengthened. COVID-19 has exposed the limitations of our global institutions, but we do not need new institutions. We need to empower the ones we have. Inadequate and unpredictable financing threatens the WHO's capacity to play a central role in global health emergencies and to deliver on its broader mandate. Member states must address this need and must strengthen the international health regulations to ensure they are fit for purpose. We must also change the way we pay for preparedness. We call on WHO and its member states, working with the United Nations and international financing institutions, to develop mechanisms for sustainable, predictable financing. These mechanisms must support national capacities and enable the development of global goods. We also need financial mechanisms to mitigate and prevent the economic and socio-economic consequences of pandemics and epidemics. Effective pandemic preparedness crosses borders, eliminates silos, and ensures that both lives and livelihoods are protected. We call for a summit on global health security to agree on an international framework for health emergency preparedness and response. This framework should consolidate and harmonize our existing mechanisms and facilitate coordination between actors and stakeholders, providing platforms for multi-sectoral engagement and community involvement and strengthening capacity and accountability. Over the years, there have been many calls for adequate financing, robust systems, and stronger governance. But we must remember that the decision to prioritize health security and invest in preparedness is a political one. The world will not be safer unless we have leaders who commit to preparedness based on solidarity and sustainability. This is a defining moment for humanity. As we respond to COVID-19, we must also take the necessary steps to avert a future pandemic. We must face our vulnerabilities and harness our collective strength with a common resolve, namely, that never can this happen again. Thank you very much.
Thank you. Thank you so much, Dr. Brundtland and Dr. Asi. And now back to Tim.
Thank you very much, Director General. On behalf of the Chair of the Executive Board, Dr. Harsh Vardhan, I would now like to give the floor to Dr. Mike Ryan, Executive Director of WHE, to provide some comments on strengthening WHO's global emergency preparedness and response. Mike, you have the floor.
Thank you, Tim, and thank you, Chair. Just for some context, the officers of the board had asked the Secretariat to prepare a paper which you have in your files, EB 14818. This was asking the Secretariat to provide an overview of the emerging themes and the emerging issues and initiatives needed to strengthen WHO's global emergency preparedness and response. At that time, many member states were working together in different groupings and being brought together and convened by the European Union in the hope of bringing together a member state sponsored paper on the same matter. and I believe the Member States have put forward a paper, a conference paper, EB 148-4, which will be considered in this session, and therefore the Member States, the Executive Board, will be able to make some decisions as how to move forward. So if you could please see this presentation purely as a way of feeding your thinking and your ideas for the following discussions, rather than a specific proposal by the Secretariat. Next slide, please. The Director General and the chairs have outlined the roles of the various committees. The Independent Oversight and Advisory Committee and the Global Preparedness Monitoring Board are ongoing multi-risk mechanisms for consultation and advice that advise the Director General and the World Health Assembly on all matters related to global preparedness and response. And obviously we have the Review Committee on the functioning of the IHR. We heard from Professor Wheeler, and the IPPR, and we heard from the two co-chairs. But in addition to that, there have been a whole series of consultations, engagements, reviews at the EU, G7, G20, G77, United Nations. We've seen national assessments, regional reviews and mechanisms being put in place, assessments, committees within parliamentary systems, and a whole series of different ways of looking at both national, regional and global preparedness. And what we're trying in this sense to distill from the perspective of strengthening WHO's and the global component of that is just to distill out some of the key themes and the key areas that have emerged. Next slide, please. So the key areas for consideration, and in a sense I heard Al-Haji IC and other previous speakers speak to some of these components, and IC just said the world will not be safer if we do not, and in a sense I suppose you look at this, the world will not be safer if we don't do the following things. To create an unbreakable chain of strengthened national health emergency preparedness and response systems. I think everybody accepts that the basis of global health security is strong national systems connected in an effective way. One can argue that you want to bypass those systems and have a system that's more direct, but it's very difficult to think about a world in which that will happen without the nation state being a central piece in protecting the health of their citizens and engaging with others in the pursuit of that global objective. We obviously need an enhanced global early warning alert response system, and really that connects all of those national systems and uses the state-of-the-art 21st century technologies I mentioned in the previous session, the epidemic intelligence from open sources and artificial intelligence-driven platform and ecosystem for the collection, collation, and intelligence-driven decision-making for health emergencies. Thirdly, and again this has arisen again and again in various reviews, we need a global health emergency end-to-end supply chain and logistics system. However, there are specific qualities to such a system. Because much of the equipment in such a supply system is highly specialized, is very often adapted to the emergency in which it's been used. You have a very high scientific pre-qualification component to that, specifying the disease commodity packages, the quality, the validation of that equipment, the testing of new equipment, the innovation. So innovation, testing, pre-qualification, manufacturing, supply. This isn't just about supply. Everything broke in this COVID-19 pandemic. It was not just a supply issue. There were manufacturing issues, there were raw material issues, there were distribution issues, there were air issues, there were competitive issues between member states. It wasn't just about logistics. It's a much more complicated challenge, and it is going to require a comprehensive, and I would dare I say it, complicated solution to make it work. We've learned many of those lessons working with the World Food Programme, UNICEF and others within the UN supply chain mechanism, but many more lessons are being learned at national and regional level. We need a global health emergency workforce to support and surge, especially in a pandemic. It's not as relevant, but we've seen thousands and thousands of health workers being able to redeploy within the nation state or between nation state. And we've seen in this pandemic it has not been even. There have been areas within countries or countries within regions that have been deeply affected. And if they had got more assistance more quickly, if we had been able to move people more quickly into those locations, we could have saved more lives. So we just don't need a dynamic data system and a dynamic logistics system. We need a dynamic workforce, cross-trained, mutually accepted and deployable to wherever they're needed at the time they're needed. We need comprehensive platforms and communities of practice to manage misinformation and disinformation. The infodemic has nearly been as tough as the pandemic in many cases, and these kinds of misinformation and disinformation cause harm. They undermine evidence-based approaches, they undermine personal and community compliance with public health measures, and our work to enhance and improve how we operate on the infodemic will be very important in future. Next slide. We need, and Maria and others are here with me, Sami and others, we have to work on the global platforms, the networks and standards to harness the knowledge, to continue to harness the knowledge and expertise, translating evidence into effective health emergency policy for especially epidemic, pandemic-prone diseases, high-threat pathogens, emerging zoonosis and biorisks. That in itself is a dynamic cycle of information gathering, assessment, creation of guidance, disseminating, implementation and review. It requires internal, multidisciplinary action, external networks and the participation of all around the world who can contribute to this process. This is in itself a massive global good that needs to be developed and delivered consistently and reliably on behalf of all member states. We need to enhance and expand the networks and mechanisms and incentives for the sharing of pathogens, biologic samples and genomic data. The Director General's announced initiative on the BioHub addresses part of that. We've had previous experiences, positive, with the PIP framework. We need to build on all of those experiences in order to ensure that that material and these data move quickly. We need to continue on the platforms created like the Research and Development Blueprint for Epidemics and ensure that we have accelerated research and innovation for epidemics between, before, during and after. This cannot just be a matter of starting this work during. We have benefited massively from the Research and Development Blueprint for Epidemics. The fact that we had target product profiles for coronaviruses and for disease X in advance, and myself and Dr. Soumya Swaminathan, who sits beside me, co-managed that network, and we're so proud to work with so many of the external institutions and the researchers around the world and our wonderful R&D Blueprint team. But that team is fragile, that alliance is fragile, underfunded, and requires significant investment to answer the demands of our member states. We need a coordinated global platform to ensure rapid, equitable access to the fruits of research and innovation. Bruce Railward is sitting to my left. The ACT Accelerator is a model, it's a platform. We may need it again, so we need to be very careful that when this pandemic ends, that if we're putting ACT away, we put it away in a way that we can rebuild it quickly, or we find ways to maintain those relationships and those systems that we've worked so hard under the leadership of all of the agencies, particularly under Dr. Tedros' leadership to drive. And we need, finally, and everyone I think has said this in every review, sustained, predictable funding for health emergency preparedness and response. I will put it to you plainly, Member States, and you said it, and others have said it. There is a massive gap between the rhetoric on funding and the reality of the funding that this organisation and our partners receive to deliver on global health security and global health emergency preparedness and response. My grandfather used to say, you get what you pay for, and in this case, we have not invested enough to deliver a system of high enough quality, predictability, that can deliver on what we all want for our citizens: prevention, prediction, detection, and early response, and a planned recovery to any of these agents that threaten our collective security. Next slide. And last slide, you'll be glad to hear. So for the world to move forward, again, I'm here more mouthing what we've seen and analysed from the various reports. Everyone and the previous speakers has spoken about political will and international cooperation being prerequisites to move forward. We need strengthened accountability in the pandemic preparedness system, building on the IHR, accountability and performance for all, at all levels. We need sustainable and predictable financing. We need an empowered and resourced WHO at all 3 levels of our organisation. The chair of the IOAC spoke about that. But that not only focuses on its capacities in global health emergency response, but also coordinates global pandemic preparedness. And obviously a multi-sectoral approach, and there are many have spoken about the international financing institutions, but the overall approach of taking a One Health approach and looking at all of the sectors and all of the agencies who can contribute to a healthy planet, to healthy animals, and to healthy people, and working very closely with the Deputy Director General to realise the vision that the DG has for the One Health Council. So that's it from my side there, just a sense of bringing together some of the issues that have arisen in all the informal and formal processes as a way of informing the follow-up discussion on how the EB wishes to move towards the World Health Assembly. Tim, you have the floor back.
Thank you very much, Mike. I now, through the chair, give the floor to the... excuse me. I now hand the floor, Your Excellency, back to the chair, Dr. Harshvardhan. Thank you, Chair.
Thank you, dear. The floor is now open for discussion. I would like to request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor once again.
Thank you, Your Excellency, Mr. Chair. May we kindly remind those member states wishing to make an intervention to please raise their hand in the Zoom platform. I should now like to call upon the distinguished delegate from Austria to be followed by Botswana. Thank you. Austria, you have the floor.
Thank you very much, Mr. President, Director General. I have the honor of speaking on behalf of the European Union and its member states, as well as on behalf of the candidate countries, Turkey, the Republic of North Macedonia, Montenegro and Albania, as well as Ukraine, the Republic of Moldova and Armenia, who all aligned themselves with this statement. We thank the Secretariat for its report on WHO's work in health emergencies. It reminds us that there are concurrent health emergencies on top of the COVID-19 pandemic that WHO is continuing to address, of which many are protracted crises where staff is also often at risk. We commend WHO staff for their tireless work, their courage, and their commitment to continuously improve WHO's emergency program. In this regard, we recall our expectations for a transparent and regular follow-up by the Secretariat on the progress of implementation of the IOAC's recommendations, including providing all WHO representatives with proper training, staffing key positions, especially in priority countries, and ensuring that the WHE program operations are transparent and free of collusion, fraud, corruption, and other types of misbehavior. To the evaluation mechanisms, we cannot stress enough the importance of your work. We are convinced that WHO must remain the lead international agency on global health. That is why we need a stronger WHO within a stronger multilateral system. We acknowledge that expectations for member states generally outweigh the current WHO capacities. The international community needs to be on board to implement bold changes. This includes taking ambitious but realistic decisions regarding the future biannual budget and sustainable financing in general, while enhancing transparency and accountability of the organization. We thank the Secretariat and the IHR Review Committee for their reports and the open meetings organized since November. We recall the great importance we attach to IHR. We must admit, however, that the world as a whole was not prepared for this pandemic. We need to rethink prevention, control, and response to global health crises. That is why the EU and its member states stand ready to explore ways to reinforce IHR implementation, including an effective system of compliance evaluation. We also stand ready to engage in strengthening member states' accountability, prerogatives of WHO, and equitable access to health technologies, leaving no one behind. We also want to stress the importance of transparent, swift, reliable, and timely communication. It is a two-way process where trust should be the ultimate cornerstone. We're ready to engage in a discussion on how member states can be better associated to decision-making when unusual health events of concern are detected and when PHEICs are declared, including by enhancing the role played by the EB in this regard. Ultimately, the responsibility for change lies in the hands of the member states. This is why the EU welcomes the adoption of a decision which paves the way for a resolution to strengthen WHO's work in emergencies for adoption at the next WHA. The EU is pleased to inform you that a draft resolution proposing a way forward to address the recommendations of the evaluation groups will be shared soon. We're looking forward to working together with all member states in close cooperation with the evaluation mechanisms and the Secretariat in an inclusive, constructive and transparent manner. Thank you very much.
Thank you. And now to Botswana, to be followed by the Republic of Korea.
Thank you very much, Chairperson. Botswana is pleased to deliver the statement on behalf of the Africa Region member states. We welcome the report on the public health emergencies and response. The region acknowledges the progress made and commend the WHO for responding to 60 graded emergencies, of which 8 were WHO Grade 3 and United Nations Interagency Standing Committee Level 3 emergencies. These include 2 public health emergencies of international concern: the outbreak of Ebola virus disease in the Eastern Democratic Republic of Congo, and the global pandemic of coronavirus disease during the period January to August 2020. We also commend the WHO for the management of emergencies through the WHO Incident Management System. The ICM has allowed for the rapid establishment of structures at country, regional, and headquarter level, as well as supported the quick release of funds within the 24 hours through the Contingency Fund for Emergencies. This has translated into the support of national governments to increase the quality and coverage of health services through strengthening primary health, secondary health, and primary hospital care, by deploying mobile teams and reinforcing health facilities, improving surveillance and early warning system, conducting vaccination campaigns, distribution of medicines and supplies, and training of health workers. As reported, our region experiences the majority of the WHO higher graded public health emergencies. Thus, we request the WHO to prioritize allocation of resources to improve capacity, to enable member states to detect events early, and for emergency preparedness and response. We welcome the WHO benchmarking tool to support building core capacity under the international health regulations. Chairperson, our region notes that the quest to deliver quality health services during the health emergency, especially in the African region, continues to be hindered by limited funding, humanitarian and human resource capacities, mass population movements during such crises, and ongoing insecurities. This therefore calls for the need for the WHO to engage political leadership in countries, the African Union, and all major relevant stakeholders so that control and containment of health emergencies in challenging environments can be achieved. Chairperson, we also thank the WHO Regional Director for the support of the member states in the IHR joint external evaluation exercise and submission of the self-assessment annual report on monitoring and evaluation. As reported, all state parties are performing better than in the previous reporting period in key capacities such as surveillance, laboratory, coordination, and IHR national focal points functions. However, we request the Secretariat to continue to improve the human resource capacity, which did not show improvement in the reporting period. Our region also looks forward to the rollout and expansion of the National Resource Mapping and Impact Analysis on Health Security Investment. This should be accompanied by the WHO tool to identify all financial and technical resources available for capacity building for the regulation for implementation of COVID-19 preparedness and response plans, in line with the recommendation and priority action arising from monitoring and evaluation of fulfillment of the regulations. Finally, Chair, the African region welcomes the second progress report of the Independent Panel for Pandemic Preparedness and Response. And we thank the panel secretariat for their work. We look forward for the next report to be presented at the 74th WHA on the progress and lessons learned from the international response of the COVID-19. I thank you for your kind attention.
Thank you. And now to the Republic of Korea, to be followed by Tunisia.
Thank you, Chair. I have the honor to deliver this statement on behalf of the 8 core members of the G4IDR, the support group for global infectious disease response, namely Kenya, Mexico, Morocco, Peru, Singapore, the Republic of Korea, Turkey, and the UAE. We appreciate the update from the IPPR, the IHR Review Committee, and the IOAC. We thank the chairs for their leadership in guiding the important mandate of the respective review mechanisms, which will be the cornerstone of our collective efforts to build a more resilient and responsive global health system in the coming months and years. Following up on our joint statement made at the 5th special session of the EB meeting, we submitted our written recommendations on the IHR improvement to the IHR Review Committee last December. The group highlighted the following areas for consideration. Member States consider improving and actively carrying out periodic joint external evaluations of national core public health capacities with clear relations between the evaluation and actual preparedness. Strengthening information sharing mechanism of the IHR by various ways, such as improving criteria and guidelines, developing a real-time platform, standardizing the tracing of contacts upon notification of a possible fake event, and strengthening consultation between member states under Article 43. Establishing a principle on the facilitation of essential movement of people in line with IHR's objective of avoiding unnecessary interference with international traffic. Proposing that the Director General of WHO should have an intermediate option in declaring a fake based on more transparent deliberation of the Emergency Committee. Providing more detailed guidelines to Member States on using digital technologies for public health purposes in accordance with IHR provisions on human rights and personal data. Lastly, encouraging WHO and Member States to make sure that IHR focal points are well equipped for fulfilling their mandate. Let me conclude by reaffirming our strong commitment to actively engaging with all relevant stakeholders to better support WHO deliver on its mandate. In this regard, we look forward to the final recommendations from IPPR, IHR Review Committee, and IOAC. At the same time, we will continue to closely work with other member states to strengthen preparedness and response for health emergencies. Thank you, Chair, and we wish you all fruitful deliberation today. I thank you.
Thank you. And now to Tunisia, to be followed by Indonesia.
شكرا السيدة المنسقة. أتشرف بإلقاء هذه المداخلة عن دول الشرق المتوسط نيابة عن دول تدرس المنظمة على التقرير المرحلي المبدئي لمراجعة أداء لوائح الصحية الدولية خلال الاستجابة لكوفيد-19 وعلى تقريرين حول عمل المنظمة في مجال الطوارئ الصحية. ونشهد بالأمانة على الدعم الذي قدمته لاستعراض اللوائح الصحية الدولية، كما نثني على أعضاء لجنة الاستعراض ومداولاتهم واستنتاجاتهم الأولية. ونتطلع النهائي في الدور 74 لجمعية الصحة العالمية. وقد تقدم تنفيذ القدرات المطلوبة بموجب اللوائح الصحية الدولية على مستويات مختلفة في بلدان الإقليم. غير أن جائحة كوفيد-19 كشفت عن عدة ثغرات في التأهب، وعلى الرغم من إجراء 19 بلد من أصل 22 في الإقليم للتقييم الخارجي المشترك وضع خطط عمل وطنية للأمن الصحي، إلا أن تنفيذ هذه الخطط لم يكن متسقا وكان غير كافي على الإطلاق. وسوف يتناول تحديث الخطط وضمان الإدماج الكامل في إطار تقوية النظم الصحية العديد من النتائج الرئيسية التي صدرت عن لجنة المراجعة. وتحتاج البلدان التي تشهد حالات طوارئ إنسانية طويلة الأمد إلى اهتمام خاص، حيث يتلاقى بها الأمن الصحي والاحتياجات الإنسانية، وينطبق ذلك خاصة على إقليم شرق المتوسط، حيث يقيم به 43% من مجمل المحتاجين لمساعدات إنسانية على مستوى العالم. ونرحب بالنتائج الإضافية التي تسفر عليها المراجعة الشاملة للصحة والتأهب وبمشاركتنا في هذه العملية. ونحن نشجع على اتخاذ خطوات إضافية لتسيير الإبلاغ عن البيانات الوبائية في الوقت المناسب مع مراعاة الشفافية. كما نحث على تحديد الحد الأدنى من متطلبات المعلومات من الدول الأطراف المتعلقة بالسفر والتجارة في سياق أحداث الصحة العالمية. ونرحب بالدعم الذي تقدمه الأمانة للنهوض بالجهود الوطنية الرامية إلى تعزيز الإبلاغ عن المخاطر والمشاركة المجتمعية. ويشمل ذلك مكافحة وبائيات المعلومات المضللة، كما أن مفهوم استحداث مستوى متوسط من التنبيه عند حدوث طارئة صحية عامة مسببة للقلق الدولي قد حظي بالاستحسان. ونعتقد أن النسخة النهائية من تقرير اللجنة سيكون مهماً للنهوض بأمننا الصحي الجماعي. وفيما يتعلق بورقتي عمل المنظمة في مجال الطوارئ الصحية، فإننا ملتزمون بتعزيز التأهب للطوارئ والاستجابة لها. ونلتمس دعم المنظمة المستمر في عدة مجالات. وبالنسبة للبلدان التي تشهد حالات طوارئ إنسانية كبرى، ندعو المنظمة إلى المساهمة على نحو أكثر فعال في بناء قدرات الاستجابة الوطنية. بما يشمل نظم الرعاية الطبية الطارئة، ويجب دعم البلدان التي تشهد حالات طوارئ طويلة الأمد لتعزيز الصلة بين العمل الإنساني والتنمية والسلام بهدف الاستجابة بفعالية للأحداث الحادة، وتوسيع نطاق التغطية بالخدمات الصحية الأساسية وتحسين جودتها، وإرساء الأساس لتعافي النظام الصحي على المدى الطويل. ثانياً، تقترح الورقة الخاصة بتعزيز تأهب المنظمة للطوارئ ومواجهتها على الصعيد العالمي 10 مجالات عمل رئيسية. ونحن نقرها كلها، وسوف نضيف إلى هذه المجالات تعزيز القدرات على إدارة الطوارئ الصحية على المستوى القطري، مع تطبيق نظام إدارة الحوادث على نحو أكثر اتساقاً، والاستفادة الكاملة من مراكز عمليات الطوارئ، فضلاً عن دراسة تفصيلية لدور التدابير الاجتماعية والقيود على التنقل في إدارة الجوائح. ونشكر الأمانة العامة على التقارير الثلاثة، ونشكركم على حسن الانتباه.
Thank you. And now to Indonesia, to be followed by Bangladesh.
Thank you, Chair. We thank to the Secretariat for the report and appreciate the work of WHO in supporting the member states to respond to health emergencies. We appreciate WHO's support in responding to poliovirus type 1 outbreak in Indonesia, which declared over by the International Health Regulation Emergency Committee in March. Indonesia take note the IHR Review Committee report and reiterate the support for the regulation as a cornerstone of international public health and health security law. We also take note the interim report of the Independent Panel for the Pandemic Preparedness and Response, co-chair, and are open for further discuss recommendations provided in the both reports. In doing so, my delegation would like to emphasize the following. The finding of lack of equitable access to COVID-19 tools due to the narrow national interest, economic power, and geopolitical urgency of our collective concern. Need support multilateral process to coordinate and monitor global health emergency preparedness and response that can be done through a stronger multilateral leadership, sustainable and predictable funding, and a stronger global health system. The panel should continue to look deeper into the various economic impact of that pandemic and the lessons learned that could be gathered for future global action. Regional response also need to be strengthened. Therefore, the panels could also derive lessons learned from regional mechanisms. Each country and region face their own unique challenges which the panel can take into consideration. Preparedness is key. Therefore, the committee should continue exploring possible measures or recommendations to strengthen the detection and surveillance system to enable real-time data gathering and provide timely information for countries to react decisively. On the role of the IHR national focal point, as noted in the report, country differ in the structure of national focal point. In this regard, the Secretariat should provide guidance to strengthen and harmonize the network to be more proactive. We also support the exploration of various initiatives for the robust system of compliance evaluation, such as the Universal Health and Preparedness Review, and ready to contribute substantially. To conclude, we note the importance for a timely sharing of pathogen specimens, subsequent information, and scientific findings. However, several key principles such as inclusivity, fairness, and equity in benefit sharing, as well as the utilization of intellectual property rights, need to be taken into consideration in the development of such mechanism. I thank you.
Thank you. And now to Bangladesh, to be followed by India.
Thank you. Thank you, Mr. Chair. We take note of the report of Director General on WHO's work in health emergencies. We thank the Director General and his team for providing us with the detailed updates on their efforts to extend maximum possible assistance to the governments to contain and come out of these health emergencies. In this connection, we note the intervention of the distinguished co-chairs of the Independent Panel for Pandemic Preparedness and Response, and subsequent presentations by the chairs of IHR Review Committee and the chair of IOSC. Mr. Chair, the governments across the continents have been grappling with the health emergencies created by the COVID pandemic. We share an observation made in the report that the risk of a crisis like COVID-19 pandemic were known, but were not addressed. It is indeed a matter of great concern. More than ever before, we realize that neither are the governments nor is the WHO equipped with or prepared for to predict, prevent, and respond to multi-country outbreak of diseases. To prevent the recurrence of such crises, WHO must continue to work with all stakeholders to mobilize predictable and sustainable funding, technical assistance, and technology know-how. There must be an extensive drive as well as committed support to strengthen and prepare the health systems, increase the coverage and quality of health services, and respond to the emergencies, particularly for the most vulnerable countries. Only then we would be able to attain a sufficient and satisfactory strategic preparedness required to face health emergencies like the current one. We appreciate the WHO that has been working very hard in tandem with the governments and international organizations to address the ongoing health emergency. However, WHO also needs to engage with the commercial and business entities to ensure the access to medicines, vaccines, and other auxiliary tools at an affordable price, available at an affordable price by the low and middle income countries. Mr. Chair, we are disturbed by the incidents of sexual violations by some WHO personnel. These incidents have tarnished the reputation of this institution. We hope that WHO will pay due attention to this issue and it will implement the zero tolerance policy on sexual exploitation it has already adopted. Before I conclude, Mr. Chair, I would like to highlight that some conflict-stricken zones, including DR Congo, South Sudan, Syrian Arab Republic, and Yemen, may continue to face untenable health emergencies in the coming days as well. This may upset the global efforts and success to contain the COVID-19 pandemic and other pandemics and endemic diseases. WHO must engage with international and national entities to explore innovative ways to garner global support and mobilize resources to ensure visible and effective remedial responses in the conflict-stricken areas. I thank you.
Thank you. And now to India, to be followed by Kenya.
Thank you, Chair. India has taken note of the report of the Director General on WHO's work in health emergency. India commends WHO on the work done for 6 grade 3 emergencies, many of which were complex and protracted due to ongoing humanitarian crisis and large-scale displacement of population. We understand that coping with such complex emergency have major challenges in terms of medical, social, public health, and humanitarian issues. We acknowledge that implementing emergency response operations at country level in these countries have been very challenging owing to the unprecedented scale and nature of disruption caused by COVID-19 pandemic. This is a major concern. Various crisis-ridden and vulnerable population deprived of equity, access to healthcare, nutrition, potable water, and sanitation are at risk of getting communicable and non-communicable diseases. This calls for concerted effort of the UN system and WHO to get these challenges adequately addressed. On the issue of vaccine, WHO should strongly push for waiver of IPRs for vaccine in order to ensure equity. Chair, benefits from core capacities built over the years, such as surveillance networks, sentinel sites laboratories, and sample shipment mechanism, could be leveraged for management of COVID. However, it is important to ensure that reprioritization of efforts in the event of medical emergencies do not cause global disruption to routine surveillance and functioning of global system and capacities. Hence, the organization should provide appropriate guidance to member states to afford higher focus to surveillance system. India has taken note of the progress made so far by WHO in monitoring and evaluation of international health regulation core capacities. However, moving forward, there is a need to enhance capacity of national health systems of many countries in addressing shortfalls in point of entry surveillance as well as preparedness against chemical, zoonotic, and radiological hazards. Thank you.
Thank you. And now to Kenya, to be followed by the United States of America.
Thank you, Chair. Kenya aligns a statement with that made by Botswana on behalf of the African member states. We take note of the report EB 148/17 and EB 148/19 presented to the Executive Board on WHO's work in health emergencies regarding 1, strengthening WHO's global emergency preparedness and response, and 2, strengthening preparedness for health emergencies, implementation of the International Health Regulations 2005. We take note of the second progress report of the Independent Panel for Pandemic Preparedness and Response. Kenya is a party to the International Health Regulations and is a member of the Global Health Security Agenda and the Support Group for the Global Infectious Disease Response. Pursuant to our obligations, we have established centralized outbreak coordination, joint planning, and an emergency response management, communication, and information management structures across all levels of government. Furthermore, our Public Health Emergency Operations Center coordinates operations, information, and resources for strategic management of public health emergencies, and we are currently mobilizing resources to implement the National Action Plan for Public Health Security, which includes public health emergencies, preparedness, and response as a major component. With regards to the review committee on the function of the IHR, we take note of the preliminary findings contained in the interim report, particularly the consideration of the issuance of guidance for events that may not meet the criteria for PHEIC, but nevertheless require an urgent escalated public health response. We look forward to receiving the final report on the committee's recommendations and the possible need for amendments to the regulations. Chairperson, Kenya appreciates the work done so far by the Independent Panel for Pandemic Preparedness and Response. We especially note the summary of the themes emerging from the reports, recommendations and wish to reiterate the importance of reinforcing the role of WHO and its governing bodies as being central to the future global health governance. In conclusion, we urge member states to continue supporting the various independent review processes so as to ensure that recommendations from the IPPR, the IHR Review Committee, and the IOSC guide future reforms of WHO financing and the global public health emergency preparedness and response architecture. I thank you.
Thank you. And now to the United States of America, followed by Singapore.
Thank you, Chair. The United States thanks the chairs of the Independent Panel for Pandemic Preparedness and Response, the IHR Review Committee, and the Independent Oversight and Advisory Committee for their updates to the Executive Board and interim reports. We align our comments with those of the United Kingdom on behalf of G7 health partners. Efforts to strengthen the WHO must be member state-led, fully inclusive and transparent, and provide a strong platform to consider and implement the recommendations of the IPPR, the IHR Review Committee, and the IOAC. The United States recognizes the European Union for developing the decision point on WHO strengthening and its efforts to lead negotiations in the intersessional period before WHA 74. We are pleased to join as a co-sponsor. All member states should provide input to this process, and we need to take time to listen to all of the recommendations that member states have to offer. It is our duty to provide the WHO and the broader international system with the tools to do its work effectively, efficiently, independently, and transparently. We must rise to this occasion even as we combat the pandemic and resurrect our economies. That is why we need to be sure that the recommendations put forward will be given thoughtful consideration, and any additional funding requests for WHO will be justified and directed at areas where strengthening is necessary, such as pandemic preparedness and response. The United States will work with other WHO member states to strengthen the WHO to make it fit for purpose. Finally, Mr. Chairman, since time is short, we will submit a written statement specifically covering the IHR Review Committee's progress report. Thank you very much.
Thank you. And now to Singapore, to be followed by Argentina.
Thank you, Chair. Singapore supports the draft decision on strengthening WHO's global health emergency preparedness and response. The COVID-19 pandemic is a somber reminder on the importance of building, strengthening, and maintaining the capacities to prevent, detect, and respond to public health risks. Unfortunately, it will not be the last pandemic that the world faces. We support a multilateral approach to health emergency preparedness and response. In particular, the role of the WHO as the world's leading health authority. It is in the interests of all member states that the WHO is more effective in being able to respond more quickly to outbreaks and health crises with broader activation of resources. In this regard, we note the call by the GPMB for a summit on global health security to agree on an international framework for health emergency preparedness. We look forward to hearing more about it. As a co-sponsor of the WHA 73.8 resolution on the implementation of the International Health Regulations 2005, Singapore recognizes the IHR as the only legally binding international law instrument to coordinate a balanced public health response while minimizing disruption to international trade and travel. In response to the IHR Review Committee's call for member states' involvement, Singapore contributed our inputs last year. We note the interim progress report by the committee. While we are still learning about whether the vaccines provide sterilizing immunity and the duration of vaccine-induced immunity, one of the key IHR challenges in the context of COVID-19 would be the global need to verify the vaccination status of travelers. In this regard, an international authentication mechanism may be useful to aid the resumption of global trade and travel. As a core member of the G4IDR, the Support Group for Global Infectious Disease Response, Singapore shares the commitment to work with the WHO and member states for a safer world, where our collective interest lies in improving the global capacity to prevent, respond to, and overcome pandemics. Thank you, Chair.
Thank you. And now to Argentina, to be followed by Colombia.
Gracias, señor presidente. Argentina toma nota y agradece los informes. Agradeceríamos que los informes como el presentado por el IPPR se hubieran publicado con anterioridad para poder analizarlos, pero nos comprometemos a estudiar este informe interino y a enviar los comentarios pertinentes. Compartimos la importancia de aprender de las lecciones de la respuesta a la pandemia y en este marco hemos compartido la experiencia argentina con el IPPR, destacando los esfuerzos realizados para mejorar las capacidades nacionales en materia de coordinación intersectorial, abordaje de todo el gobierno, acciones de liderazgo a nivel nacional y subnacional y la implementación de medidas de salud pública, entre otras, el intercambio de información genómica del virus que circula en el país. Como dijimos anteriormente, la pandemia de COVID ha dejado de manifiesto la necesidad de jerarquizar el RCI en la Agenda de Naciones Unidas, donde participan los jefes de Estado con el fin de facilitar su cumplimiento. Agradecemos el informe presentado por el Comité de Examen del RCI y Argentina coincide en que no se requieren modificaciones al RCI, sino fortalecer su aplicación. En relación al sistema de alerta gradual, desalentamos cualquier sistema que burocratice el cumplimiento y el seguimiento del RCI, el cual ya es complejo en la actualidad. Por lo tanto, solicitamos que cualquier modificación que se realice brinde mayor claridad al respecto. Por otro lado, nos preguntamos si todos los procesos de evaluación y revisión que se están llevando a cabo al interior de la organización no se están superponiendo y solapando esfuerzos entre sí, demandando en su lugar estrategias de superación que contemplen las brechas organizacionales y la disponibilidad de recursos propios del grado de desarrollo de cada país. Finalmente, nos llama la atención la inclusión en las conclusiones del documento 18 de la propuesta del Consejo Europeo sobre la celebración de un tratado que no ha sido circulado ni puesto en conocimiento de los Estados miembros, afectando la posibilidad de análisis y debate. Quedamos a la espera de las próximas recomendaciones durante la Asamblea Mundial de Salud en mayo. Muchas gracias.
Thank you. And now to Colombia, to be followed by Australia.
Thank you, Chair. Agradecemos al director general por el informe presentado sobre preparación y respuesta frente a emergencias de salud pública y encomiamos el trabajo de la Organización Mundial de la Salud al apoyar a los países durante el periodo que comprende el informe, no solo en materia de la pandemia por COVID-19, también con aquellas emergencias que exigieron una respuesta por parte de la organización durante el último año. En cuanto al COVID-19, consideramos que la labor que ha hecho la organización ha sido clave para los países en la formulación de planes de respuesta y mitigación del impacto de la actual emergencia sanitaria. Somos conscientes de que la articulación de los Estados miembros con la OMS es fundamental para seguir preservando la vida de nuestros ciudadanos. Asimismo, hacemos un llamado a la organización para redoblar los esfuerzos y el apoyo brindado, teniendo en cuenta el incremento considerable de casos de COVID-19 en nuestros países y a la aparición de nuevas variantes del virus. Al respecto, consideramos fundamental toda la información que se pueda recopilar por parte de la OMS en materia de emergencias, así como a través de los comités y mecanismos de examen activos en el marco de la COVID-19, con el fin de dictar medidas de fortalecimiento de los sistemas de salud nacionales basados en evidencia científica y en lecciones aprendidas. Por lo anterior, sugerimos la realización de un informe sobre la gestión regional de emergencias que contribuya al intercambio de experiencias y buenas prácticas. Respecto al informe sobre el fortalecimiento de la preparación y respuesta de la OMS frente a emergencias mundiales, tomamos atenta nota de la necesidad de avanzar colectivamente con todas las herramientas que permitan mejorar la preparación frente a emergencias sanitarias, el intercambio de información en el marco del RSI, el desarrollo homogéneo de las capacidades nacionales, el fortalecimiento de la capacidad de laboratorios y el control preventivo de la escasez de insumos médicos y otras tecnologías de la salud son temas de gran relevancia para Colombia. Nuestro país está listo para participar en los procesos de consulta y de discusión sobre las diferentes medidas a adoptar en el fortalecimiento de la preparación y respuesta de la OMS, de las regiones y de los países frente a futuras pandemias, tal como el examen universal de la salud y la preparación, la financiación sostenible, la gestión de la desinformación y demás. Agradecemos el trabajo realizado por los miembros del Grupo Independiente de Preparación y Respuesta a las Pandemias y al Comité de Examen acerca del funcionamiento del RSI durante la respuesta a la COVID-19. Agradecemos la consideración que ha tenido sobre las recomendaciones y comentarios presentados por los Estados miembros y los animamos a continuar compartiendo estos informes interinos, los cuales presentan valiosos insumos para la discusión sobre el fortalecimiento de la organización y del Reglamento Sanitario Internacional. Para finalizar, agradecemos a la Unión Europea por la resolución presentada y acordada entre los Estados miembros sobre el fortalecimiento de la OMS, la cual permite avanzar de manera conjunta en esta discusión. Queremos resaltar que debe primar el espíritu colaborativo, cooperativo y solidario de todos los Estados miembros, avanzar en el fortalecimiento de una estructura mundial de prevención, preparación y respuesta a emergencias sanitarias mundiales. Thank you, Chair.
Thank you very much. And now to Australia, to be followed by the United Kingdom.
The COVID-19 pandemic has had an unprecedented impact on the world's health systems. Our global architecture for health emergency preparedness has been tested and found wanting. A step change is needed to meet current and future health crises. The independent evaluation of the COVID-19 response and the progress reports from the Independent Panel on Pandemic Preparedness and Response in the IHR Review Committee will guide us in the collective actions we must take. Australia affirms and appreciates this important work. The panel has provided a frank assessment of the world's risk management and preparedness planning for pandemics, noting critical elements of the system are slow, cumbersome and indecisive. Australia agrees with the panel's observations that the COVID-19 pandemic must be a catalyst for fundamental and systemic change in preparedness. We look forward to detailed recommendations from the panel about how to organise collective global action, as well as country and regional reforms to address these deficiencies. While there may be some quick fixes, reform efforts will require a comprehensive and systemic approach. Our work ahead of the World Health Assembly will need to reflect this. Australia affirms the need for an independent and authoritative WHO and strong WHO operations, particularly in emergency response and at country level. We must take urgent action to reducing risks of zoonotic disease transmission through an enhanced One Health approach. We note the WHO Director General's comment during PBAC about strengthening the One Health concept. A strategic plan fully integrating UNEP into these efforts is needed. We agree with the IHR Review Committee that effective implementation of the IHR requires sustained political will, leadership and prioritisation based on health systems that provide accessible care to all. Australia remains a strong supporter of consistent international health emergency arrangements and an active participant in the IHR monitoring and evaluation framework led by WHO. It's important we work together to ensure the IHR continues to strengthen so as to be fit for purpose for the future. We view global cooperation as the key mechanism for enhancing global health security to prepare for and respond to emerging health threats. We note the preliminary findings to date and remain open and receptive to the need for additional recommendations as the review work continues. The WHO plays a fundamental role in coordinating and supporting the global response to health emergencies. Ultimately, member states must work together to ensure global systems are in place for preparedness, prevention, detection and response to health emergencies, and to strengthen their own national health systems to the greatest extent possible. Despite the broad range of activities WHO has undertaken across a number of health emergencies, the critical need for a more responsive and better resourced WHO remains. We must maintain a sense of urgency and ambition for reform. Australia will continue to actively support and engage in the panel's work. Thank you.
Thank you. We are mindful of the time difference for many of our member states, so thank you. And now to the United Kingdom, to be followed by the Russian Federation.
Thank you, Chair. I speak on behalf of the delegations of the G7 and Australia and the Republic of Korea. Thank you to the chairs of the Independent Panel for Pandemic Preparedness and Response and the IHR Review Committee for their updates to the board and their interim reports. Although due to the timing of the papers being released, it wasn't possible for us to make detailed remarks on them here. The G7 greatly values WHO and the crucial leadership and coordination role it plays in global health and in steering the world's response to public health emergencies, especially at this difficult time. We also recognise that there is need to strengthen and reform the WHO to ensure it remains fit for evolving challenges, including with the continued strong support and involvement of its member states and the international community. The global health architecture also needs to increase its focus on preparedness and response to health emergencies, as well as building more resilient, quality and inclusive health systems with a view to achieving universal health coverage. The G7 supports the decision on emergency response submitted by the EU. We therefore welcome the work of the review committees with their mandates from member states and look forward to their recommendations to the World Health Assembly in May, which we need to be ambitious, grounded in robust evidence, and with clear prioritised areas for action. Some of the issues that the review processes are examining have been discussed before, including improving IHR compliance through a stronger member state-led review process and monitoring framework alongside a more consistent evaluative system that can accurately assess national IHR capacities. Elaborating the process of independent epidemiological assessment on site and prompt information sharing, including samples of pathogens when outbreaks occur, especially in the initial phase, in close collaboration with the relevant national government. Fully integrating a One Health approach to better prevent, detect and respond to zoonotic health threats. Greater clarification of roles and coordination among member states and the wide range of international organisations involved in response to pandemics, including in case of cross-border movement by sea or air, and finding sustainable financing approaches which allow for WHO to fulfil its core mandate within the global health architecture in an effective, efficient and strategic way. Some changes do not have to wait for these reviews. There are areas that WHO already has started to work on or could advance in the shorter term. For instance, strengthening communication around the decisions of the emergency committees, setting up of the One Health High-Level Expert Council by WHO, jointly with FAO, OIE and UNEP, in coordination with relevant initiatives, including the One Health Global Leaders Group in antimicrobial resistance, facilitating greater access to global public health intelligence to support countries and global organisations with timely and actionable intelligence, implementing the recommendations on management of the WHO Health Emergencies Programme as recommended by the IOC, establishing the groundwork needed to fully implement an early warning or intermediate public health alert system as part of the fake declaration process based upon previous IHR Review Committee recommendations, enhancing WHO's normative role on guidance on handling health emergencies, indirect health and socio-economic impacts, and maintaining essential health services, providing clearer and more updated guidance on travel and trade restrictions and their impact in order to avoid unnecessary harm to economies, working with other relevant international organisations, and improving member state engagement in public health emergencies, including by strengthening the role of this executive. We must use this existing momentum to make these urgently needed changes happen. We therefore have high expectations for these reviews and look forward to closely looking at your recommendations. And to WHO, our message is that we stand ready to work with you and other member states to strengthen emergencies response. Thank you.
Thank you. And now to the Russian Federation, to be followed by Germany.
Уважаемый господин председатель, Российская Федерация приветствует проводимую ВОЗ работу по борьбе с чрезвычайными ситуациями в области здравоохранения, в том числе с пандемией новой коронавирусной инфекции. Пандемия стала серьезным испытанием для национальных систем здравоохранения во всех странах, обнажив проблемы готовности к реагированию и на глобальном уровне. Невозможно обеспечить эпидемиологическое благополучие в отдельно взятом государстве. В основе защиты от инфекций коллективный потенциал на региональном и глобальном уровне. Россия поддерживает центральную, координирующую и лидирующую роль ВОЗ в международных усилиях по защите здоровья населения от угроз инфекционных болезней, а также во внедрении международных медико-санитарных правил. Считаем недопустимым создание механизмов, дублирующих функции ВОЗ и подрывающих ее координирующую глобальную роль в сфере борьбы с эпидемиями. Не видим необходимости в пересмотре ММСП. Приоритетной задачей является совершенствование механизмов внедрения правил, включая оказание содействия нуждающимся странам в наращивании потенциала по выполнению ММСП, методическую и консультационную поддержку национальных координаторов, совершенствование на основе принципов многосторонности механизмов и регламентов проведения обзоров правил, а также совершенствование работы чрезвычайных комитетов, создаваемых в рамках ММСП. Подчеркиваем важность создания условий для использования ММСП в качестве инструмента развития систем здравоохранения и инструмента защиты здоровья людей. Поэтому считаем недопустимым попытки использовать правила для оказания давления на страны в целях контроля за их потенциалом в области биологической безопасности и борьбы с эпидемией. Необходимо в полной мере уважать суверенитет государств-членов. Выступаем категорически против введения обязательного механизма внешней оценки исполнения ММСП. Это общая позиция стран Евразийского экономического союза. Большое значение для работы по укреплению потенциала ВОЗ в сфере готовности реагирования на чрезвычайные ситуации в области здравоохранения будут иметь рекомендации соответствующих экспертных органов, имеющих мандат от стран-членов, в особенности Комитета по обзору функционирования международных медико-санитарных правил в условиях пандемии COVID. Обратили внимание на положение представленного исполкому доклада комитета, касающиеся обмена информацией между отдельными странами и ВОЗ. В связи с этим отмечаем, что оценки и выводы комитета должны быть объективными и непредвзятыми. Поддерживаем призыв к разработке проекта резолюции 74-й сессии ВАС по вопросу укрепления потенциала ВОЗ в сфере готовности реагирования на глобальные чрезвычайные ситуации. Готовы принять активное и конструктивное участие в этой работе в кооперации со всеми странами-членами. Благодарю вас.
Thank you. And now to Germany, to be followed by Finland.
Thank you. Germany aligns itself with the EU statement delivered by Austria and with the G7 statement, health statement delivered by the UK. Germany likes to express its thanks to the IPPR, the IHR Review Committee, the Independent Oversight Advisory Committee, and the Global Preparedness Monitoring Board. We deem your work highly essential to learn from the greatest global health crisis of our time. Two things were true before COVID-19 appeared a year ago, and they remain true even once we will have overcome this pandemic. First, it might not be clear when and how the next global health crisis will strike us, but it is clear that there will be a next one. And second, among others, the international structures to prevent, detect, and respond to such a pandemic have proven to be insufficient to prevent the greatest global crisis of our times. COVID must be understood by all of us as a turning point for global health and global health security. President Sirleaf, you rightly called for a reset. We must be willing to do everything to ensure that this never happens again, and that we are truly prepared for the next global outbreak of such a dimension. This calls for our common responsibility and investment in global health preparedness. To defend the status quo or to only implement the so-called low-hanging fruits cannot be an option. We have to rethink how we are doing business. We have to overcome our common comfort level if we want to be successful. COVID might be the greatest health crisis in recent times, but as others before us have said, there were many others before, like the Ebola crisis in West Africa just 5 years ago. All these health crises also created lessons learned processes which produced recommendations in order to prevent similar crises in the future. Out of these roughly 200 recommendations coming out of these more recent lessons learned processes, only 10 have been implemented, mostly only partly, and mostly the so-called low-hanging fruits. Colleagues, we do not have a lack of recommendations to make the world less vulnerable to global health crisis. We do have a lack of common political will among 194 member states to learn from past mistakes and to implement these recommendations. Coming back to our indeed high expectations vis-à-vis the four panels, we hope and expect from you not less than that you are pushing us 194 member states to overcome the insufficient status quo of global health preparedness and to fully implement bold, ambitious, and truly needed improvements in global health preparedness. Because the world cannot afford to experience such a global health crisis again in the future. I thank you.
Thank you. And now to Finland, to be followed by China.
Okay.
That's okay, when you're ready. Thank you.
Thank you. Okay. Sorry. Chair, Finland aligns herself with the statement made on behalf of the EU and its member states. We thank the Independent Panel for Preparedness and Response, the IHR Review Committee, as well as the Secretariat for their reports, and the IOAC and GPMB chairs for their updates. We appreciate the openness of working methods and regular communication on these important issues. 1 year ago, the 146th Executive Board adopted a resolution on preparedness, which was adopted also by the World Health Assembly in November. The inadequacy of the world's preparedness efforts has become devastatingly clear. The resolution called for investment in key public health functions as a basis for preparedness and sustainable response. Strong and resilient health systems and the continuation of provision of essential health services are critical during the crisis. The importance of gender response approaches and the engagement with communities also become clear. Many of these themes discussed a year ago emerged across the interim reports received for the consideration of the board. We look forward to the IHR Review Committee's assessment of potential changes needed to existing instruments, for example, in relation to public health emergency of international concern and access to pathogens. The pandemic highlights the importance of strengthening cooperation across sectors of society and promoting the health of humans, animals, in the environment. Yesterday, we noted the work planned by the Secretariat in establishing a One Health high-level expert council. One Health collaboration is a long-standing practice in Finland. The IHR monitoring and evaluation framework has helped countries to gain an understanding of the level of their IHR core capacities and to exercise their functioning, as well as to strengthen multi-sectoral ownership. The joint external evaluations have promoted open sharing of information about preparedness among peers in a constructive way. The lessons learned so far can provide valuable basis for further improvement of the IHR monitoring and evaluation, in particular as the functionality of the preparedness arrangements. Importantly, we have to better understand how countries can ensure appropriate resources and political leadership and commitment to strengthening preparedness. Going forward, the development of more permanent and inclusive platforms for cooperation, innovation, and delivery will be essential for the rapid response to evolving health threats. Finland echoes the consistent message by the previous committees and by the current evaluation groups. Investing in preparedness is a necessity and a lesson we cannot afford to overlook. Thank you.
Thank you, Finland. And now to China, to be followed by Oman.
主席先生，中方感谢 瑟利副总统和克拉克总理牵头的独立小组、IHR 审查委员会以及独立咨询委员会的工作。IHR 是全球公共卫生安全的法律基石，中国坚定支持在 IHR 框架下协调应对国际突发公共卫生事件。一是中方注意到条例审查委员会提交的中期进展报告，注意到报告的总体评价，以及在此次抗击新冠肺炎疫情事件中暴露出的条例有关条款和实施过程中存在的问题和挑战。中国支持对条例进行修订完善，进一步推动全球团结一致、科学有效抗击新冠肺炎疫情，这符合国际社会的共同利益。面对未知的新冠病毒，中国第一时间向世界卫生组织通报疫情信息，第一时间分享了病毒基因序列，第一时间采取了最全面、最彻底、最严格的防控举措，取得重大战略成果。中方希望提醒大家注意的是，报告第25段提到缔约国和世界卫生组织秘书处的沟通可能存在延误的表述与事实不符，未能全面真实反映中方与世界卫生组织在2020年1月1号到1月3号沟通的事实。二是中方积极支持 IPPR 的工作，向独立小组提供了中国抗击疫情的详实的时间线，以及疫情防控、救治方案和各项措施、政策和相关论文等大量的文件资料。但我们遗憾地注意到，在独立小组报告第29段、第30段部分表述与事实不符。从武汉报告不明原因肺炎开始，武汉市、湖北省、中国国家卫生健康委就立即组织专家对患者病情、临床治疗、流行病学调查、实验室检测等方方面面全面进行了调查分析。在尚不清楚病原体的情况下，我们第一时间提示公众避免到封闭、空气不流通的场所和人多集中的地方外出戴口罩等等。武汉市在2020年1月1号就关闭了华南海鲜市场，并在公共交通场所对离开武汉人员进行体温监测。这些工作的开展都是在病原体未明、病毒独立和传播力不明的情况下采取的超常规应对措施，为中国乃至全球抗疫赢得了宝贵的时间。我要指出的是，用今天对新冠病毒和疫情的了解，对最早期的情况进行判断，这不符合人们对事物的认识的基本规律和经验。2020年1月23号，中国以外仅有4个国家报告7例患者的情况下，中国宣布武汉实施公共交通管制，对拥有上千万人口的武汉按下了暂停键。这是非常艰难果断的决定，但我们做了，为全球抗疫付出了巨大的代价。这些举措远远超出了传统的公共卫生措施。我们呼吁国际社会科学、理性、实事求是地看待中国抗疫努力。这些超常规的、最有力的公共卫生措施，是中国抗疫的宝贵经验和创举，也是对全球团结抗疫的重大贡献。中方建议审查委员会和独立小组对报告进一步完善，从预防和应对两方面做出科学、客观、公正、全面、平衡的评估，呼吁各国展现积极的意愿，支持小组在全球范围内开展评估工作。同时希望各成员国关注当前抗疫的紧迫问题，如公平分配疫苗等等。中国愿意为推动全球团结抗疫、构建人类卫生健康共同体做出贡献。谢谢。
Thank you. And now to Oman, to be followed by Austria.
جزيلا سيد الرئيس.
قامت سلطنة عمان بمتابعة الأوضاع العالمية والإقليمية للوضع الوبائي لمرض كوفيد-19 منذ منتصف يناير عام 2020. وقد اعتمدت السلطنة في استجابتها للجائحة على عدة مرتكزات للصحة العامة، وأهمها القيادة الحكومية الموحدة، والتي تمثلت في تشكيل لجنة عليا تضم جميع الجهات والقطاعات ذات العلاقة، زيادة القدرة الاستيعابية ومرونة النظام الصحي بحيث يستطيع توفير الرعاية الصحية لحالات كوفيد-19 دون الإخلال بخدمات الرعاية الصحية الأساسية، الشراكة المجتمعية وتفعيل دور الإعلام وقنوات التواصل المجتمعي على كافة المستويات، الاستفادة القصوى من التحول الرقمي والذكاء الاصطناعي في الاستجابة للجائحة بما يشمل التواصل وتقديم الخدمات الحكومية، العمل مع جميع الشركاء لتطبيق اللوائح الصحية الدولية في منافذ الدخول، العمل على توفير لقاح كوفيد-19 لجميع السكان عمانيين وغير عمانيين. وقد قامت السلطنة في الاستجابة لجائحة كوفيد-19 بالأخذ بمبدأ المساواة والعدالة في توفير الحماية من المخاطر والعناية الطبية لجميع السكان سواء كانوا عمانيين أو غير عمانيين، كما التزمت بتطبيق اللوائح الصحية الدولية في الاستجابة للجائحة. وتود السلطنة التأكيد على منظمة الصحة العالمية والمجتمع الدولي حول أهمية الشراكة العالمية لتبادل المعلومات فيما يتعلق بطوارئ وأحداث الصحة العامة وتبادل المعلومات الوبائية والقدرات التشخيصية، وكذلك مشاركة العينات ذات العلاقة بالأوبئة من أجل دراسات التسلسل الجيني واللقاحات. كما تؤكد السلطنة على ضرورة التوفير العادل للقاحات للدول ذات الدخل المحدود والمتوسط. شكرا سيدي الرئيس.
Thank you very much. And now to Austria, to be followed by the United Kingdom, who will be making national statements. As we understand, the earlier statements were joint regional groupings. Thank you. And Austria, you have the floor.
Thank you. Austria aligns itself with the statement on behalf of the EU and its member states. We commend the excellent work of the 3 review committees and welcome the report on WHO's work in health emergencies. There are already so many points made to be picked up for next reform steps. We are looking forward supporting these proposed measures. Early risk communication and information sharing on public health events and international spread is fundamental for effective preparedness and response measures on a national level. Considering the speed and impact of social media, effective and timely communication between the WHO and the member states becomes even more important. Having this in mind, more transparency with regard to the criteria on the declaration of a fees is necessary. Clear criteria would allow consistency in the decisions of the emergency committee and could enhance the support and understanding of the decisions from the member states. The criteria and underlying evidence for a fees should be made available to the member states in a timely and transparent way. We welcome the discussions on a possible intermediate level of alert, but clear criteria on its introduction should be explored in more detail. An intermediate level of alert as an initial warning signal could speed up communication and allow early action for strengthened preparedness and rapid response in accordance with raising awareness on national level. The consequences of declaring an intermediate level of alert should be part of further discussions. Thank you.
Thank you. And now to the United Kingdom.
Thank you. Further to our remarks on behalf of the G7, we have some additional comments to make on the papers in our national capacity. Firstly, we thank the review teams and chairs for their pragmatic and helpful observations. We're pleased to see reflections on updating the early warning system to become more nuanced and modernised, the transparency of the emergency committee, and on the universal health and preparedness review pilots. We agree that the role of the IHR national focal point should be strengthened, and with a focus on enhancing the existing IHR framework. The UK remains committed to supporting countries to achieve full compliance with the regulations. And more broadly, we encourage the review chairs to work closely with the regional committees and officers who have important insights to share also. The field mission of the international experts to Wuhan is an important part of the investigation into the origins of the SARS-CoV-2 virus. The investigation must be open, robust and scientifically rigorous to ensure that lessons are learned for future pandemics. We look forward to hearing further updates as the work progresses. Finally, we emphasise WHO continuing efforts to strengthen the operational and administrative resilience of the overall health emergencies programme, not only for pandemics, but as WHO continues to respond and to lead in several other complex emergencies. This includes fully implementing the full breadth of IOC's recommendations over recent years, ensuring strong leadership in the most complex contexts, further developing recruitment and administrative capacity, and ensuring conflict sensitivity and a relentless focus on safeguarding staff and communities. Thank you.
Thank you. And now to the last two statements by members of the Executive Board, the Republic of Korea and followed by Chile. Thank you.
Thank you, Chair. We would like to express our gratitude to the IPPR, the IHL Review Committee, and the IOAC, who made dedicated effort since launch to conducting reviews based on scientific evidence and objectivity with their mandates from the member states. We anticipate that the final recommendations of each committee will become a clear guideline for the actions that member states should take in the short to long term. Moreover, the Republic of Korea will continuously offer our full support to ensure there are no setbacks to the three committees' work. An early detection of a possible PHEIC event and notification to WHO must be promoted by member states. To this end, surveillance required by the IHL, particularly the establishment of evidence-based surveillance system and the strengthening of diagnosis capacity, as well as the function of the national IHL focal point, is very important. Notably, the current information asymmetry we are witnessing between member states with regards to the function of the national IHL focal point should be improved based on the recommendations of the IHL Review Committee in the future. In January 2020, the Republic of Korea notified the WHO when an imported case of COVID-19 was confirmed through the early detection and diagnosis. To date, we have been detecting COVID-19 cases at an early stage through large-scale tests and reduce transmission as much as possible through constant tracing. In addition, we have been continuously sharing information on the current status with UPRO and our experiences with the international community. Our current discussion on the improvement of IHL will serve as a stepping stone for WHO's effective and proactive response to future global infectious disease based on the lessons we learned from COVID-19 pandemic. In this respect, the Republic of Korea would like to extend our sincere appreciation to the G4IDR core group for their past commitment to discussions. We would like to express our support for the G4IDR joint statement and ask the member states for their keen interest. Finally, the Republic of Korea conveys our support for the G7 joint statement on the activities and role of IPPR, IHL Review Committee, and IOAC. And we will continuously engage in discussions with the Secretariat and the member states on matters requiring longer-term reforms, including a full integration of One Health approach and sustainable financing. Thank you.
Chile agradece el informe del director general, así como el trabajo de la Secretaría para efectuar esta sesión del Consejo en modalidad completamente virtual. La pandemia del COVID-19 ha modificado formas de trabajo y más aún, modificado nuestras vidas y nuestra convivencia. En este cuadro valoramos la capacidad de adaptación de la Organización Mundial de la Salud para responder a los desafíos que han surgido y renovamos también nuestro compromiso de contribuir al esfuerzo global para enfrentarla, así como también de trabajar globalmente para, comillas, garantizar una vida sana y promover el bienestar para todos en todas las edades. En estos tiempos, la labor de la OMS renueva su valor. El mundo entero ha integrado vocablos propios de la epidemiología y observa atento el avance en el desarrollo de las vacunas. La Organización Mundial de la Salud y sus Estados miembros deben persistir en el espíritu y dirección propuestos por el acelerador de acceso a las herramientas contra el COVID-19 y particularmente por el mayor acceso a vacunas a través de la iniciativa COVAX. Saludamos igualmente el trabajo desarrollado por la OMS en cumplimiento de la resolución COVID-19 adoptada por la Asamblea Mundial de la Salud número 73 y particularmente el proceso de evaluación de respuesta de OMS al COVID-19. Nuestro país, Chile, tiene esperanzas en que este proceso fortalezca a la Organización Mundial de la Salud, entregue lecciones orientadoras concretas para que en el futuro la respuesta de los países y la respuesta de la OMS sean aún más rápidas y eficaces. Chile llega al fin de su participación en el Consejo Ejecutivo, periodo en el cual ha intentado materializar su compromiso con el multilateralismo. En este sentido, las propuestas de mejora a los instrumentos de respuesta a pandemia que nuestro país entregó al director general fueron el fruto de un trabajo colectivo y agradecemos el apoyo y el interés de los países de la región para contribuir en este esfuerzo. Finalmente, durante su participación en el Consejo, Chile ha desarrollado un esfuerzo por promover la temática de envejecimiento saludable, poniendo el acento en el carácter multidisciplinario del logro de este, que ha sido liderado en Chile por nuestra primera dama. La pandemia puso en evidencia la vulnerabilidad de los adultos mayores, siendo el grupo más afectado. Como país, tenemos la convicción de que el decenio por envejecimiento saludable del 2021 al 2030, aprobado por la Organización Mundial de la Salud y adoptado por Naciones Unidas recientemente, contribuirá a que los adultos mayores, que nosotros llamamos adultos mejores, gocen de salud por el mayor tiempo posible. Nos despedimos renovando nuestro compromiso para trabajar por las iniciativas de salud global y el logro de vidas más largas, más sanas, más saludables, más plenas y más felices para todos en todas las edades. Muchas gracias.
Thank you very much. We shall now move to statements by those member states not represented on the board. I should wish to give the floor to the distinguished delegate of Japan, to be followed by Pakistan.
Thank you, Chair. We appreciate IHL Review Committee, IOSC, IPPL, and GPMB to report their findings. Japan co-sponsors the decision proposed by EU at the EB 148, WHO's work in health emergencies, strengthening WHO's global emergency preparedness and response. Especially regarding IHL, some questions about the current regulations and the operations of them were raised. Bearing these in mind, to prepare better for the next pandemic, in line with promoting universal health coverage, I have 3 points to raise. Firstly, the member states need to ensure and strengthen the role and the functioning of IOSC as a legitimate oversight body for WHE. Secondly, the member states should consider strengthening networking and early reporting mechanisms during crisis-free times to enable swift initial response. Thirdly, it is important to strengthen surveillance capacities during crisis-free times, including collaboration with member states and regional crisis management centers. Taking this opportunity, I would like to present relevant development on global health in Japan. Recently, recommendations on strategic expansion of international collaboration scheme and health ODA have been submitted, which was created at the public-private committee consisted of Diet members and technical experts in Japan. Based on this recommendation, Japan is committed to contribute to the health for all people in the world through more effective and intensified international collaboration in health, including contribution to the reform of the global health framework, which emerged from the response to COVID-19. The intended contribution includes promoting UHC at global level through strengthening quality, resilient and inclusive health system and sustainable health financing, and also through strengthening multi and bilateral cooperation with a consistent strategy. Thank you.
Thank you. And now to Pakistan, to be followed by Zambia.
Thank you, Madam Moderator, Mr. Chairman, and honorable delegates. Pakistan has noted the interim report of the IHR Review Committee and appreciates the efforts of the WHO and its relevant committees in this regard. The COVID-19 pandemic has revealed systemic gaps and vulnerabilities in health systems globally vis-a-vis pandemic preparedness and response. It has also shown that how quickly any new virus can sweep away the decades of hard-won social and economic gains. The interim report of the IHR Review Committee also identifies important pointers related to states' capacities, early warning, and methodology of determining a public health emergency of international concern. The Review Committee must focus on minimizing all factors that can cause delays, as pointed out earlier by the Chinese delegation. Pakistan sees COVID as an opportunity for the world to translate this pandemic as a catalyst for a lasting and systemic change in preparedness for better responding to future incidents. There is indeed a renewed realization that more decisive and effective steps may be taken for developing IHR core capacities. Mr. Chair, the existing level of collaboration and assistance needs to be scaled up and aligned with the national efforts meaningfully for all countries to develop strong, resilient, and integrated health systems. We believe that any discourse on IHR must embed the focus on technical assistance, financing, and capacity building to allow developing countries to achieve their public health goals. It is also important to ensure that the